this is we really have an all-star panel with us today. So we're excited to introduce each and every one of you. Again, my name is Danielle Sedgwick. I got into the cannabis industry in the middle of 2015. I put together a lot of the cannabis conferences and expos from coast to coast. About 2 or 3 years ago when we launched Mita, Dimitri had asked me to come along and kind of help streamline the process of it. So, I've just been really active in the Arizona cannabis community for the last couple of years. So,
yeah, and thank all of you for joining us. These, as I was saying earlier, will become part of an important historical record, an important period in our time, and hopefully we can get back to normal here soon. But, Mita strives to provide information for everyone, citizens, media, employees, industry members, partners, investors, owners, across the board. Sharing information is the key to knowledge. So Mita is really proud to host the individuals on this panel today who are willing to come out into the public, to be transparent, to be accountable, and to share their knowledge of what's happening in the Arizona industry. An industry will be a cannabis industry, an industry we'll all be learning about for decades. So this is fantastic that you guys are all here. But let's, without further ado, text. Yes, we're missing Nate from Grower's House, and a bunch of people were looking forward to seeing him. So let's go ahead and get started and introduce yourself, and take a minute or two so the audience out there could know who you are and where you're from, and a little bit about your company, your service, or your good. Let's start with the shirt that I happen to be wearing because I am in such great shape, although I usually wear a three-piece suit. Copper State, Punkage. Tell us about yourself. When did you start in the Arizona industry? And tell us about Copper State.
Yeah, I'd love to. So I started in the industry about 1.5 years ago, and my background is all consumer packaged goods. A fun fact about me is I started my career at Procter & Gamble actually at baby care, and I was working as an engineer in one of our diaper factories for Procter & Gamble with Pampers. So I was literally a diaper engineer for 3 years, if you can believe that. So I've been in CPG my whole career. When I got to Copper State and in cannabis, I was just blown away at how fast the industry was scaling and growing. And as some of you may know, Copper State's a vertically integrated seed to sale company. We have one of the largest greenhouses for cannabis in the US. I'm proud to have the team who's steeped both in cannabis and in I'd say the dispensary side of the business in terms of retail, in terms of the way we take care of our patients. I got a great team behind me. So that's us in a nutshell at Copper State.
How many employees do you have over there at Copper State now?
We have grown a lot. The farm, we've been expanding at the farm, and we have 2 retail dispensaries under Soulflower. So we've almost doubled in size. We're up to 350 employees.
350 employees. And Soulflower is your retail dispensary brand.
That's correct.
Okay. Well, thank you. We'll get back to you, Punkage. Thank you for joining us. Let's move on. I'm just going to go to Andrew from Uncle Herbs, who just joined us. Sorry about any technical difficulties we had, Andrew. Good to see you. Looking good. Oh. All right. You got to come off mute, Andrew. Your computer's on mute.
Can you hear me?
yeah, we can hear you now.
Oh, we can't hear you again. You off again.
Back in 2011 and 12, I was buying real estate in Arizona. I was a firefighter in Alaska.
Andrew, we're having technical difficulties with your audio. I'm not sure what's wrong. Give us 1 second. We'll come back to Andrew. Alec, you want to go next?
Sure. Thank you, Dimitri. I'm Alex from Starhouse Distribution. We're the official distributor of iLava, Drip, and Boveda here in Arizona. Today, we have a really, really exciting announcement about iLava and a new campaign that we've started, and I'm really excited to share it with everyone. So thanks for having me.
Okay, and I'll come back right to you, Andrew. Let's get that technical difficulty. Alec Pagliario, I can't pronounce his last name, but Sunday Goods, representing
Okay.
Sunday Goods.
Everyone always messes it up. This isn't the first time. I'm just kidding. But yeah, I'm from Sunday Goods. You know, we just launched our retail operation over off 16th Street in Glendale. Beautiful, beautiful dispensary that we were really fortunate to open up during a pandemic. But yeah, I mean, one of our core values is definitely providing an elevated experience to the patients here in Phoenix. We do have our cultivation site called The Farm that many of you probably know of. It's over off in Wilcox. So it's about, 45 minutes past Tucson. That's upwards of 250 to 300 employees at that site specifically. My location over at the dispensary, we have about 20 rock stars. Definitely a great team. Great product. We provide sun-fed, soil-grown, geothermic, well-raised flower. So it's awesome product. If you guys have never had it, recommend you to come in, try some of our premium greenhouse flower. We also have a Rockstar wholesale team that distributes all of our flower throughout dispensaries across the state. So definitely kudos to them for have been, laying the foundation for retail for just like coming up right now. But yeah, that's it from me from Sunday Goods.
How many employees over at Sunday Goods now?
We have, well, in total as a company, it's going to be upwards of 350 total employees.
It's incredible. And I'm always pleased to bring this up in front of Dr. Humble, because when I remember August 2012, there were 0 employees. And now here we are, and we have 300. Last question, your branded flower and your branded products fall under what name?
Well, the Sunday Goods is actually going to be our top grade premium greenhouse flower. And then it's all actually comes from The Farm, which is the name of our cultivation site. But we have exciting brands coming out here soon with that.
Cool, thank you. Let's go with Mark Steinmetz.
Mark, you got to unmute.
We see
Can you hear me now?
Yeah.
All right, very good. So I'm the founder of Nature's Medicines. We've been in business since 2013. We've developed the brands, as you can see behind me, Nature's Medicines, Nature's Flower, Concentrates, Vape Fruit, Phoenix Cannabis Company, and we're about to release Reefer Gladness, which is our new kitchen line of brownies and cookies and various forms of edibles, gummy bears, of course, and other lines coming. So Nature's Medicines is now, it started in Arizona when I won the license back in 2012, and we are now in 6 states with 13 dispensaries and 4 cultivations and about 600 employees, half of which that reside here and work in Arizona.
So you guys are an MSO as well, I guess, multi-state operator?
Yeah, we're not publicly traded. We're still private, but yeah, we are in 6 states, and we have other applications pending.
I still haven't tried Vape Fruit, but I love the name. Thank you, Mark. I've known you since August 2012, and you're one of the most intelligent guys in this industry. So it's a real honor to have you here.
Thank you.
All right, let's go with Frank from Sublime. Hi, Frank.
Representing Sublime.
Greetings, everyone. I'd just like to first thank everyone who's joined and participating in this.
Can you speak up a little bit, Frank?
Yes, sir. Just want to thank everyone who's joined and is participating in this. I'd like to thank Dimitri for being clever enough to create such a venue for the industry. My name is Frank Craley. I am the VP of Operations at Sublime. We're also a producer of the brand Corova that initially started in California, but we've brought it over here to Arizona. It's renowned for its potency, more so here in Arizona than even in California, with all the changes that have taken place in California with the rec market. We one of the largest edible brands in the state of Arizona. Thanks to both the Corova and Sublime brands. But, we also produce everything else. We're one of the few wholesalers in the industry that produce in every category. We've got over 100 SKUs. So we're able to be a one-stop shop for all of our partners. And I'm happy to say that everybody I see on this panel, we are partners with. So We've got a nearly 100% market penetration. We've got a great team of about 60 people that work at our manufacturing facility. We're always innovating. I'm very flattered for the position and opportunity that I've been offered at Sublime. We plan to be a part of the industry and part of the solution to COVID as things progress.
Awesome. Frank, tell us what's one of Sublime's most popular products?
Wow, that'll be the lemon tea cake. That is a very, very popular product. It's won many awards actually. And then on the Corova side, it's that 1,000 milligram black bar. People understand the value of that. That breaks down to 8 cents a milligram. And then last year on 420, we launched the ultra black bar that is 2,000 milligrams. And that also sells very well. That sells at 7 cents a milligram.
Curious, Frank, just real quickly, don't you also work with Stony Yoni?
Yeah, Stony Yoni's another one of our brands on our wellness side.
You want to talk about what Stony Yoni is and how it works, or maybe later?
Maybe later, sir.
All right, let's move on. John Hartzell got that. Thank you, John Hartzell. John Hartzell gets my jokes.
Yeah.
All right, so let's move to
Well,
John
dude,
Hartzell.
it's sex lube. Fantastic product, by the way. It works.
Yes. We'll talk about Stony Yoni after 5 o'clock. John, you're up. John Hartzell.
Again, thank you so much, Dimitri and Danielle, for the wonderful communication and the leadership during time where we cannot really get together in another format. So awesome job getting us together. I want to take a minute to say thank you to our entire staff who's sitting out in the front office right now. You guys kick ass, DISPO team. I really appreciate all the hard and dedicated work through this time. And as I look at the panelists on this call we've got here, there's not a single licensed organization that DISPO has not done or isn't currently doing business with. And it's indicative of the loyalty our community has to each other and doing business with local organizations and supporting each other, not only during these times, but during the attack we had from the judges up in northern counties, during legislative attacks from our legislature, which has had and taken issue with our industry, through organizations like META and the ADA and others, and our campaigns to bring high quality communication throughout the industry really supports that close and loyal network. And I want to thank all of you who are loyal customers to DISPO, loyal to the industry through your businesses, and really very importantly want to thank our staff here who has been in full operational mode and bringing packaging throughout the state to those brands that choose to use us. So thank you very much.
Thank you, John Hartzell. Andrew, how are we doing? Andrew Provencio, my favorite.
Better now.
You good now?
I'm good, thank you. So
you are wearing my favorite color, so you're next.
Okay, Andrew Provencio. I'm with Uncle Herb's, and I got a license just like Mark did back in 2011 and 12. I was a fireman in Alaska, and I retired from the Anchorage Fire Department after 30 years and moved here. We had a big virus back when I was employed, and it was called Ebola and AIDS back when I was employed. So the virus situation has always been here for responders. I would like to thank Dimitri and Daniela for putting this on. I really appreciate the response we get and the interaction. And then we have multiple products also. We have multiple SKUs in excess of 100 SKUs, as well as we have a jewelry company that runs through our property. It's High Point Jewelry. It was recently rebranded. And then our highest selling product is chill pills. And those chill pills that we see right here, we have those in indica, sativa, and hybrid. And we make those in 5, 10, 25, and 100 milligram single piece liquid gel caps. So So that's Uncle Herb's, and we have a great crew, a great team, and they all do great work.
You know, this is really cool because Sublime, Chill Pill, Vape Fruit, Sunday Goods, Copper State, these are names that we're going to be hearing across the United States. You know, I Love a Touch, you know, this is really cool. If I missed anybody, this is exciting stuff. Starhouse, probably be an international distributor. It's good stuff. Thank you, Andrew. And I have jewelry from you guys, but I forgot to wear it, so I apologize.
Which chill pill do you recommend for talking in front of large audiences?
You know what? I recommend the Chill Pill for sleeping. And I honestly, I've been saying this since 2013. I think that marijuana will replace NyQuil one day, and the Chill Pill might be that first. I mean, it's you know, NyQuil doesn't make sense. We'll get into that later. Will, it's always a pleasure to have an attorney here for us, giving us your time. You're on mute, Will. Will Fischbach from Tiffany Bosco. Tell us a little bit about yourself, where you're from, and what your firm can do in the industry.
Great. Thank you so much for having me today, Dimitri. Again, Will Fischbach. I'm a commercial litigation partner at the firm of Tiffany and Bosco. Our primary office is here in Arizona, but we also have offices in San Diego, Las Vegas, Orlando, Birmingham, Michigan. I think I've got all of them. I have participated in many different types of disputes involving the industry, be it in the form of receiverships, disputes between partners in a dispensary operation, disputes over ownership over particular licenses. And it's just been a real pleasure to take those cases because I find that the issues are very interesting and raise very challenging concepts of law, and I tend to like a challenge.
Well, we thank you for joining us. And it's always good to have your lawyer around here. So if we have any legal questions, we're going to channel them back towards you. And thank you very much. Mo from iLava.
So I've been in the industry since.
Oh, could you speak up a little bit?
Yeah, is that better?
Can people hear him? Are you good? Okay. A little bit louder.
Testing, can you hear me?
Yeah, we can hear you.
All right. So yeah, we basically opened up downtown dispensary here in Tucson in August of 2013, and then we got our second one, D2, up and running in August of 2017. So what we've really done is had a cultivation build out at the same time, and also launched the brand iLava, which is now in I think close to 80 dispensaries throughout the state. But yeah, prior to that, I was in healthcare information systems, and it actually ended up being a really smooth transition because it's a lot of compliance, rulemaking type stuff. So I think everyone's got such diverse backgrounds, in our industry here that, yeah, we really are an interesting group when you look at it. Thank you again for hosting this, guys.
Yeah, thank you, Mo. And Liz, a quick introduction. We're going to get to you later, but if you could mention who you are.
Yeah, absolutely. Hi, guys. So pleased to be here. I am Liz Tahura, the president and co-founder of the newly rebranded BDSA, once BDS Analytics. And we are the premier source of market research and data for the cannabis industry and for Arizona specifically. Been very pleased to be part of the Arizona market for about 3 years now.
And for those of you who don't, you guys have been putting on some, you guys are putting on some amazing webinars. So we really appreciate what you do for the national industry.
Absolutely. Excited to share a few of those insights with y'all today.
So let's get to our guest of honor today, who I was going to read something about, but I'm just going to I'm going to wing it. It's been my great honor for the last 8 years to get to know Dr. Humble. I give him his honorary doctorate. He always reminds me, but Dr. Humble in a personal way. He is a man of great integrity, a true public servant of the highest caliber. And unfortunately, after he built the Arizona medical marijuana industry from 2010 through 2015, he left the office to pursue other things. And that's when Kara Christic took over, something in 2015. But Dr. Humble did an amazing job, as every single person on this panel knows, and every single person in this industry knows. working through a very complicated situation that nobody knew. You know, it was all brand new between 2010 and 2015. So he was winging it, and I think, you know, I mean, did a pretty good job. But COVID, how this relates to COVID. So Kara Christ, as we know, is the current DHS director, and she has been in charge of Arizona's COVID response and all things related COVID to the industry as well. Had Dr. Humble still been there today, he would obviously be making the decisions that Kara Christ is there making. So he's come on to the show today to answer questions from the panelists and to tell us a little bit about his perspective on what's happened with COVID in Arizona and in the last 2 or 3 months. His opinions, his perspectives are very valuable, very insightful. And we thank you, Dr. Humble, for joining us very much. And the floor is yours.
All right. Thanks, Dimitri. And I'll try to be brief. I'll give a big sort of a broad overview of where we are, I think. I do want to spend a little bit of time on where I think the shortcomings are right now with the response. And then we can have some Q&A, something like that. I don't know if you want to touch about, you know, on the voter initiative that's coming up in November, but I just want to spend a couple of minutes on that too. Just so you know, like what we're doing as an association. So as you mentioned, I was at the Department of Health Services for about 25 years. I was fortunate to be the director during the Brewer administration. And to be honest, you know, setting up the medical marijuana program was probably one of the most fun things that we had to do during that time, because it was just super entertaining. The stakeholders were interesting. The media attention was, you know, acute. The public was really interested in what we were doing. And I think I was really fortunate to have the opportunity to work for Governor Brewer, because her management style was that kind of let us do our thing. Yeah, which is, you know, by the way, one of the things I tell people is it's, you know, because it's a lot more important. The management style of your governor is a lot more important than their ideology. You know, you could work for a governor that you're on total sync with ideologically, but if their management style is, for example, micromanaging, it can be an unpleasant experience. I never really agreed ideologically with much of what Governor Brewer, with her priorities, but she was the type of governor that trusted us. And so that's in part why we were able to construct a good program, is we were given the latitude without being micromanaged from the right. And they basically let us wrote the rules. And, you know, we made some mistakes along the way. There were some things that I didn't anticipate that became problems, but by and large, I think we did a pretty good job by setting up the regulatory system the way we did, by ensuring that there'd be a wholesale market for products, and that it wasn't a vertical integration, which we could have done in the rules, which would have made a completely different industry than we have today. But I think that was probably one of the key decisions we made, which was, you know, to allow for a wholesale market, you know, between the cultivators and the dispensaries. So anyway, stepping into COVID for a minute. So I want you probably already know the basic stuff, which is we have continuing community spread of the virus. The stay-at-home order did a decent job at flattening the curve. And I will say that the health department and the Association of Hospital Association did a good job at increasing the hospital capacity and ICU bed capacity, so that we got through the peak, at least the initial peak of the virus, without exceeding our hospital capacity. So I think that is an objective that was largely achieved, at least for now, through the hard work of people like you and the people in Arizona, throughout the stay-at-home order. One of the bigger challenges that's continuing to be out there is the lack of testing capacity in the right places, and the lack of personal protective equipment in the right places. And the reason I say in the right places is that the bigger entities like Banner, Dignity, et cetera, because they have the economies of scale, they're able to buy personal protective equipment, masks, gloves, et cetera, to treat patients, whereas the small entities like the community health centers, and especially places in the rural parts of the state, rural hospitals, are having a much more difficult time getting the kind of personal protective equipment that they need. And so I think that's one of the areas that you don't hear much about media wise. That's a real challenge, which is the big, the big operators have plenty of PPE and don't have any problems with that regard. Same thing goes for testing. One of the big challenges that we have is that, until we get a vaccine, one of the major tools that we have in public health is contact tracing and good testing so that we can identify new cases quickly. And the testing has been a real problem for the last 3 months. And places like Banner and others, Walgreens, et cetera, have plenty. They've got the economies of scale, and they can buy the test kits that they need to do these mass test events, for example, on Saturdays. But again, the real problem are in the community health centers, in the clinics, the small operation clinics where they have clinical interface with patients. They need to do that diagnostic testing, but they can't get the test kits because the big operators have bought them all, because the vendors, the wholesalers, they want to sell, thousands and thousands of units, and the small operators can't afford it, and therefore become not a desired customer. So those are a couple of the big things that I think are continuing to be challenges right now.
Let me ask you a question, if I may.
Yeah.
When you started in 2010, marijuana, the public policy perception of marijuana has changed so much. When you heard that marijuana was an essential business and would be allowed to stay open during the pandemic, during the shutdown, what were your impressions? What were your thoughts at that point?
Well, I just think that Ducey didn't want to fight it. It's a voter approved thing. It's called, it's you look at the statute, it's medicine. So how can you say that medicine isn't an essential service? So I wasn't surprised, because the barn was on fire, and you don't want to pick another fight when the barn's on fire.
And looking back on what you've seen, the decisions being made by the governor and Kara Chris, is there anything substantially that you might have done different that you think would have been a better decision? May I ask that?
So it's an interesting question, because I think when you look at the big decisions that they made, when do we start the stay-at-home order? How do you construct it? The timing of it. Those big decisions, I think, have been okay by and large. My objections have been mostly process and the lack of transparency in terms of how they speak to the public, the lack of candor that they've had with the community. And so I think overall the decisions have been actually pretty good, including the decision today, which was to send a message to the school districts that they're encouraging, the Arizona Department of Education is encouraging the districts to start class again in August. That was his press conference this afternoon. So I don't disagree with those decisions, but I have had a fair number of disagreements in terms of being transparent with the people of Arizona. So I've taken it upon myself to, as journalists come and ask for perspective about, the decisions that are being made, the epidemiology of it, the priorities that are being set by the administration and the counties, that I've been out there and available to talk. And I think I'm providing at least I hope I'm providing a good service, because there are not that many people out there that can speak without having an elected official constrain what they're able to say. And so by running the small nonprofit that I have, I'm actually a free agent. I know I'm not making any friends on the 8th and 9th floor by some of the stuff I'm saying, but because I've disagreed with some of the decisions they've made, and I tell them why.
Well, your level of expertise as how the DHS director is thinking now is quite significant. We have some questions from the panelists. I'm going to go around. I'm going to start with Mr. Hartzell. Do you want to go first?
Sure. Dr. Humble, appreciate the good words and information that you're sharing, and making friends or enemies on the 8th and 9th floor is always just temporary. But truly appreciate the words. When you're talking about shortages of PPE or testing facilities and other really essential services to this industry, are there any provisions like they have on a national level to collect supplies that are in demand to spread them across those locations and high need areas. And also then again, of course, when these schools come back, as you say, and potentially in August and September, will they have access to that PPE? And do you have any information regarding that? As a father of a couple of oncoming sophomores, it's of great importance to me.
Yeah, so good questions. No, I don't believe that there's an organized effort on on the part of state government to be sort of a purchaser, wholesaler, or distributor of PPE or testing equipment. It's a very decentralized system here. State Health Department hasn't really taken an active role in doing anything like that. I'm not throwing stones at them for having not done that. I'm just telling you that's not what's happening. And so that's why we have this as a result where, the small community health centers and small rural hospitals are having a real hard time getting test kits and PPE, which is the core things that they need to do their job, and will continue to need that throughout the next several months. In terms of schools, I think the real key will be to set up a safe environment where there's good screening in place, so that, for example, before school starts, you can have a process by which the temperature of all the students are taken, before they get into the classroom, to ensure that you have the kind of disinfectant you need for the desks, to make sure that there's hand washing, and that the students are reminded by the teachers for hand washing. And most important of all, that if there's any kids with a cough or any kind of symptoms at all, they need to get them isolated and call the parents and get them picked up, because the key here is really to create a safe environment, not a risk-free environment. And that's the thing about starting up school. And that's why I don't disagree with what the governor decided today, because, schools provide a lot of services that are super critical, not just the education, it's nutrition, it's physical activity, it's the social connectedness that they get from school. So it's not just math, science, and that kind of stuff. It's the environment that it creates, and it creates a more healthy mental health environment too, when kids can connect. And so I think overall, the benefits of opening school outweigh the risks, but the risks are still there. But schools are going to be responsible for managing those risks, making sure that sick kids don't end up in school, and that they have the kinds of disinfectants and things that they need to manage the risk. But having said that, there will be outbreaks, in school.
Yeah, so allergy season is going to be a lot of fun. Everybody's going to be wearing a mask just because of allergies and be thrown out of their school. But Frank, let's everybody has a question, so let's make the question short and the answer short. Frank, what was your question? You're on mute, Frank.
Yeah. I just wanted to comment on the question about cannabis being essential. Northern California was one of the first large populations to go into a stay-at-home situation, and they initially tried to make cannabis not essential, and that went over like a turd in a punch bowl, and they had to retract that very quickly. And then here in Arizona, you can't have it both ways. If you're going to say that cannabis is medical, you can't all of a sudden decide it's not for medical purposes.
Right.
So, I had quite a few people calling me, asking me, what my thoughts on it was. And I felt as long as the pharmacies were open, that we should be open, because the number of dispensaries is directly tied to the number of pharmacies. So I just kind of wanted to talk about that a little bit. And then I did have a question for Dr. Humble, more along the lines of the testing in the cannabis industry that's coming for the rec market. To this point, there have been no approved testing facilities. And, we make products that are 6-9 months shelf time, and I can't even test my product to make sure that it's viable come 1 November. That's a real problem for us in the industry. What are your thoughts on the flexibility of that date and the letter of the law versus the spirit of the law, and the intent of making that date 1 November? And, how can we go about doing what's best for the industry under the circumstances?
You want my honest opinion on that?
I do. So.
I think you guys need to get ready to sue them. I mean, if they're not going to get ready, by that I mean the Department of Health Services, if they're not going to be ready for a statutory mandate that they have, and that costs you as an industry to be, so that you can't be in compliance with the state statute, you got to sue them.
There's Tiffany Bosco. There's your first job here for this thing. But you know what, Frank, you actually gave us a really good idea. We can do a whole hour or two on testing and the upcoming testing, probably at the beginning of July. The June META is going to focus on up and coming women in the cannabis industry. So that will actually be our July topic. We'll do the whole testing. We'll put that all together. Thank you very much for that.
You know, Dimitri, it's not the first time Sublime has been cutting edge here.
Well, you just are cutting edge man. Pankaj, your question for Dr. Humble.
Yes. So Dr. Humble, we were debating this just today with the Soulflower team. I have a dispensary in Tempe with a very small footprint, but our dispensary in Sun City is blessed with a lot of real estate, where we have a big lobby and this educational multi-purpose room. And we're gonna embark upon the journey of going from one-to-one patient advocate to patient facilitation of the transaction, to where we're going to allow patients to come inside this large lobby and segregate themselves into this educational multi-purpose room. A debate we were having is it okay for us to mandate a patient to enter, quote, our dispensaries, that they need to wear face masks, or is it okay for us to take temperatures as a temperature check, which some retail and potentially some dining facilities we've read about have been doing. We've decided at this point not to make it mandatory, but to encourage it. But I was curious your point of view. There's tons of media discourse on this back and forth, and it's getting political, unfortunately. But what's maybe a more scientific point of view around a way to keep our patient advocates safe as well as our patients safe? So basically, as a matter of law, you could do anything you want. I mean, there's no mandates in place. It's all voluntary. You know, the only thing the governor says is that you need to be within CDC guidelines, but there's no enforcement. So, and I know you didn't ask the question that way, but in terms of best practices, I think the best thing to do is to look at the risk factors for your clientele and adjust your policy to that. So for example, let me think of an analogy. Let's say, okay, I know you're a dispensary, but let's say you were a faith-based organization, a church, and the people that go to your church are all, by and large, mostly 70 and 80, and some people in their 60s, some families, but mostly older people. Well, then you ought to set a policy so that you're taking temperatures before you have your services, et cetera. You need to be extra careful because you're working with a high-risk population. And so I would take a look at who both your staff and the customers that you're talking about, and then adjust your policy so that you're consistent with the risk factors that they have. So if you've got folks that are at high risk for having complications from this virus, then you ought to err on the more rigorous side of those control measures. But if it's young people and that are at lower risk, you know, it's reasonable and I think ethical and scientifically valid to back off on things like temperatures. But in no circumstances would I get rid of symptom checks. Symptom checks are super critical. That's coughing, dry cough, those kinds of symptoms. You can look them up on the CDC website. So that's basic answer for that.
Okay, great. Mo, did you have a question?
Well, I think, testing for cannabis is one of those things that's been an issue, and I don't think we've talked about that enough. I know Dimitri can talk about it more in July, but just from a public health perspective, let's say you have some dispensaries who do have tested product and some who don't. You know, the risk of having these clusters of people, Phoenix, the limit is 2,000 square feet for dispensaries, Tucson, it's 4,000. So you're going to see these patient populations like cluster together. So a lot of them are immunocompromised, especially, what we see here. So from a public health perspective, do you think it makes sense to have that argument? And if you were still director, would you look at that and say, hey, we need to eliminate the testing issue because it's going to lead to supply chain problems, but also patient safety issues, because you're now going to be lumping all these people together in really small confined areas if not everybody has tested product.
Oh, so what you're saying is that if some of the dispensaries can't meet the statutory mandate to test for those new testing requirements, then all the patients will be going to
A few other, like less dispensaries, right? Today we have 235,000 patients in Arizona, and let's call it 120 dispensaries. If that was to drop by even 30% or so, you'd just see a population go into a much smaller group of dispensaries.
Yeah, no, I mean, I think to me, I sort of think about that as if to try to prevent that from happening in the first place.
Yeah.
You know, there's some talented people at the state health department and the laboratory. I think Steve Baker is he the point person on this?
He is. Yeah.
So he's a talented, smart guy. He should have the resources that he needs to set the standards in place. What I would do as an industry is just work with Victor and Steve and just try to get it done. Don't try to go through the director's office. That's a waste of time. Go to Steve, go to Victor. They're good guys. You could work with them. So that's my advice, is to try to prevent that from happening in the first place.
What's Victor's last name?
Victor Waddell, Waddell. So it's, you know, the nomenclature for emails there is the first name dot last name at azdhs.gov. So Victor Waddell, Waddell.
Thank you.
Steve Baker, and then Ward Jaycox, Ward.Jaycox. Those are three people you can count on. You know, and I know I've heard that Steve is really interested and really wanted this to happen so that he could, because it would be interesting for his career and stuff. So that's my advice, is to work with those guys in the lab and see if you can find out if there's critical control points that they're missing, or, you know, what it is that they actually need that's holding things up.
Okay.
Awesome. Andrew, did you have a question next?
Andrew Provencio from Chill Pill.
And Uncle Herbs.
I like Chill. Andrew, go ahead.
I had a question. So, you know, doctor, with the comorbidities that are out there and the aging and the, you know, the people with, you know, different types of things that cause them to be more likely to have a negative effect. And then we've heard a lot about the vaccines and herd immunity. And then we've heard about this big group of people that has no signs or symptoms. And I guess what I was thinking is, like 6 months or a year from now, when we have a little bit of herd immunity because of a vaccine and so forth, where do you think this ends up in 6 months or 1 year out? Where are we going to be? Is it the herd immunity that kind of gets us and we just accept this virus? Because it's not going to end ultimately.
Right. So ultimately you hit the nail on the head. What kills epidemics is herd immunity. And there's two ways you can get herd immunity. One is that enough people get sick and recover and have antibodies so that they're essentially vaccinated. I mean, that's what this virus is doing right now. It's naturally vaccinating people. It's infecting them, they recover, they get antibodies, and they're basically vaccinated. But ideally, you don't want people to get infected to get herd immunity, especially for something serious or that can be serious like this. You want to have a vaccine. And so right now there are 3 trials underway that I know of, and I think there's probably more than that. The biggest is a coordination between Germany and the UK. They're in phase 1 large clinical trials now. They've doing both safety and efficacy. The animal studies have been promising. So I'm confident that we're going to have a vaccine. I don't know exactly when. My guess would be something like January. But I think actually it may be something like 3 or 4 vaccines. Because one of the things we're seeing with this epidemic is there's such an investment in vaccine development and technology that there are parallel tracks happening with different kinds of vaccines, because governments are throwing a lot of money at this. And I think what could in the end happen is that there could be 2, 3, maybe even 4 FDA approved vaccines, you know, for sure by a year from now, but hopefully within 6 months. And then one of the key decisions public health wise and public policy wise is going to be, how do you prioritize the initial doses of vaccine? You know, so and I haven't seen anything on that from the CDC, because you're not going to get 350 million doses all at once. It's going to come, you know, 1 million doses this week, 1 million next week, 2.5 million the week after. So, you know, production line doesn't happen overnight. And so, you know, prioritizing who gets that vaccine is going to be a little bit dicey. I think there's an evidence-based way to do it. That doesn't mean that public policymakers are going to use evidence to set those priorities.
Well, Mark, you guys are up with your questions next. But just real quickly, if anybody knows how to volunteer for one of those phases where they do human trials, I'm in. Because like this shirt, Copper State shirt, it's got me feeling like Superman. I mean, I don't know if it's the tightness or what, but I think I can handle it. So bring it on.
Hey, Dimitri, what size is that? A medium?
This is a large, John.
Looks kind of like a medium to me.
Yeah, it's a good shirt. Will, do you have a question for Dr. Humble?
No, I would just really like to make a comment after what Dr. Humble had said, and just, I think there's a lot of viability in what he said in terms of state and local governments, not doing what they need to be doing so that businesses can do what they need to be doing. I would just caution the group that anytime you bring a claim against a municipal entity or a municipal employee, you've got to do two things. One, file a notice of claim with the proper authority within 6 months, and then file suit within 1 year. And in terms of what causes of action you could have something like a writ of mandamus to compel the government to act, or if a government actor has been grossly negligent or intentional in its conduct, you could have a possible claim for damages. But
I was specifically thinking of mandamus.
Yeah, and but you mentioned damages as well. If you
did I say damages? I didn't mean to. I did.
Quite all right. That's what I inferred there. And
no. I wasn't thinking damages at all. I was thinking about mandamus to say, I was thinking mandamus.
It's okay. That's what we have Will here for. Will, you jump in anytime you want. Correct everybody. Do whatever you want. You're the high-priced lawyer here. Mark Steinmetz, broadcaster, journalist, everything. Do you have a question for Dr. Humble?
Well, I don't have a question so much as I just have a comment. I just like to give Will kudos for developing the program the way he did. I mean, he got it off in Arizona on the right foot. And I don't know that I fully appreciated all of that at the time. And I think I speak on behalf of the Arizona Dispensary Association and many of the fellow members who are also involved in MSOs, multi-state operations. Now that we've seen it operate in several other states, Pennsylvania, Maryland, Connecticut, Massachusetts, and so forth, we really appreciate the Arizona program and the way that the rules are written, the way it was developed. So I know starting anything new is very difficult. You're going to get a lot of flack. Not everybody's going to agree with the policy decisions that are made, but looking back at that, you did an excellent job getting it off on the right foot.
I just want to spend a second on a little bit of background on that. So just so you know, one of the approaches that I took through the rulemaking process was to make sure, and this is why I think a lot of people misunderstood me at the beginning, is that one of the things I wanted to do was to start off extremely rigorous and strict with the initial drafts of the regulations. And one of the reasons I needed to do that is because I worked for a very conservative executive branch, and I needed to start at a place that was far more restrictive than I wanted to end up. So that it gave me an opportunity to back off, but also built confidence with the executive branch that they could trust me and that I was going to be a rigorous regulator in terms of how we operated and implemented the program. And so if you'll recall, one of the very first decisions that we said we were going to make was to require that there be a 1-year physician-patient relationship between a doctor and his patient before that doctor would be allowed to sign a certification. Now, when that initial draft regulation came out, people thought I was serious about that. Now, I knew I wasn't going to end there, but I needed a place to start my negotiation so that I could come back and end up at a reasonable place, which is, I think, where we ended up. So, one of the things you have to think through when you're a regulator that's developing a program, you have to think through how you're going to do it, not just where you're going to end up.
Well, you did a great job. Thank you.
I'd also like to add, Director Humble, that, back in the day in 2013, when I was sending you emails about, this verification system, you were very active in working with me and, helping all of us, because it was a dispensary system-wide issue when AZM MVS was not working. So again, you were more hands-on. I think the current director has been, so I really want to thank you for that.
Now, I always thought of this program as a priority because the voters approved it and we had an obligation to do a good job with it. So I took a personal interest in it, and I understand that the current director doesn't have the same level of interest that I had.
You know, Dr. Hubble, may I offer you something? It's not much. I don't have much to offer, but there's another rulemaking process coming up after Smart and Safe wins in November. There'll be another rulemaking process. If one of these other associations or dispensaries doesn't pick you up to represent them and help them in that rulemaking process, you can definitely represent META. We'd love to have you. We just don't have a very big budget. So
yeah, well,
throwing that out there.
No, I'm not a high dollar kind of guy. I help people for free most of the time.
Right.
I've only done a couple consulting gigs, and I didn't really like those. So I think we're probably at the end. I do want to sort of plan since you talked about the voter initiative. So here's what we're planning as an organization. So my nonprofit is called the Arizona Public Health Association. We have about 800 members. It's a membership organization, 501c3. Our core mission is really public health policy. And so we've been looking at the act itself. We had some of our members and interns actually put together about a 20-page paper that we're going to be putting up on my blog in the next few days that does an in-depth analysis of the public health risks and benefits of the retail marijuana voter initiative. From my perspective, the things that I see are the primary public health benefits are that the initiative actually finally gets us to criminal justice reform. To me, the criminal justice reform component is the public health benefit. The fact that less than an ounce is removed as a felony from the books, that has a big impact on people's ability to make a living, on the criminal justice system generally. The same goes for expungement. So while I would love to see the expungement be automatic, at least it provides for an expungement process, and that allows people who have been convicted of less than an ounce convictions to be able to clear their record, which I think has a good positive impact on the social determinants of health. So there are other benefits as well. Those are the key big ones. Obviously, on the downside is that anytime you're going to transition from a medical program to primary retail, and I know medical will still be there, it's going to provide more opportunities for straw buying so that younger people, especially kids under 20, have more access to the product, and that's bad for their brain development. So on the negative side, I see more opportunities for diversion to people less than 21. So what we're doing is putting together like I said, we've got a sort of the analysis paper, and then I'm going to be talking to our public health policy committee within the nonprofit to make a decision about what kind of position to take on the initiative. But just so you know, the statements in the voter guide, the secretary, you send them into the Secretary of State. You can put your comments into the voters guide. It's limited to 400 words, but the due date for that is June 17th already. So the due date for getting comments into the voter guide is before the signatures are actually due, which is July 2nd. That's kind of interesting, kind of weird thing. So we expect to put comments into the voter guide. What I expect us to do is what we did in 2016, which is we put together the public health benefits and the public health risks of the language in the initiative, and then put that short analysis into the voter guide. And most likely we'll put the same language in the argument for and in the argument against. So I don't think we're going to take a stand and say we're for it or against it, but we're going to take a position where we're going to try to responsibly and objectively be able to inform the public about what the risks and benefits are.
Well, thank you, sir. If you don't mind, we'll put your email on our website. Also, we're going to send you a couple of these U of A masks. I had a bunch made. You and Liz get some of the speakers, bear down. I know you're a big fan of the U of A.
All right, send them to the office.
Yeah, no, text me your email. You text me your mailing address. I can send them.
All right.
And thank you. You're more than welcome to hang around and ask questions. We're going to move on now, though. Thank you, Dr.
Thanks for the
Humble.
invitation.
You're always welcome in our presence, and everybody loves you.
Thank you.
Thank you. And now we're going to move on to Liz. There you go. Sorry.
Busy man.
He's a busy man. Liz from BDSA, but first, because I promised Alex that we'd get him out of here, there's something cool happening in the corner. For those of you who can see the iLava Touch, iLava advertisement up here. As far as I know, and anyone on the panel tell me if I'm wrong, this is the first ever live 3D dedicated sponsorship advertisement done ever on Zoom. Has anyone seen one ever on any other Zoom calls? Anyone?
Never.
Never.
So Mita decided to dedicate a camera specifically to our sponsors, Eco Pride and iLava. So keep this in mind. We treat our sponsors really well here.
We sure do.
So Alex, tell us about our sponsors.
Thank you so much, Dimitri, and major gratitude to Dr. Humble for joining us. And so I'm just going to shift gears a little bit and chat about a project that we've been working on since well before this pandemic, and I'm very excited to share with you guys. So yeah, as you can see, there's some products up here. And you know, last year at iLava, the Tucson team and I began working on an internal plan, and we called it the Eco Pride Standard. The purpose of Eco Pride was to pivot all of the packaging used in the brand towards environmental sustainability. We set a goal of reducing the use of plastic in our products by over 50%, and I'm thrilled to announce that we have far surpassed that goal. Today, we've produced a new manufacturing mold at a really high cost, and we've paid 30% plus tariffs for importing the products like our sustainable bamboo jars. And contrary to popular belief on sustainable packaging, we actually have improved the quality of the containers while maintaining the brand integrity. So you can see everything in the background there is 90% plastic free. Our Touch Eco Pride 3.7 ounce. So this is a new larger size available of the iLava Touch, the #1 selling topical in Arizona. It's a biodegradable bamboo on the outside, and the inner container is made of a sugar cane derived PLA. And this is produced without any use of fossil fuels. All of our clear gold and atomic vape cartridges now use a custom molded fiber insert instead of the plastic inserts. And our magma and lumen extracts, which is shown there, the plastic container lids are coated with a biofilm to degrade rapidly in landfills. But the jar is made with resilient and recyclable German glass. So this summer, we're transitioning all of our iLava Delta 8 vape cartridges to the Eco Pride packaging and eliminating any plastic. And we're really proud that we can do this without increasing the costs to our wholesale customers and patients. There's so many exciting ways that we're going to incorporate Eco Pride planetary packaging into our customer-facing marketing programs. But why this is important is this is one of the biggest challenges our industry is facing, this high perceived ecological impact of the product packaging. And Eco Pride is more than a package. It's a signal to the general public that we as an industry are conscious of this problem and taking steps to solve it. So this is just a preview for Mita members and guests. These products are going to be available in limited quantities on LeafLink starting May 31st. And if you'd like some more information, feel free to shoot us a message. Stores can contact us on LeafLink. We do business with the vast majority of stores in the state. So to everybody that has helped make iLava Touch the #1 selling topical here, we really appreciate all of your support. So thank you for your time, and we're really looking forward to rolling this out.
Very cool. Alex, you said May 31st it'll be available?
Yeah,
Okay.
just a couple days.
So does anybody have any quick questions about their new product or their campaign? All right, good. And so check it out. I've already upgraded the idea. We're doing well with the 3D sponsorship in the corner, but I don't know if Sunday Goods or Chill Pill or Vape Fruit or Tiffany Bosco or Sublime or Copper State has a mascot. But this is what I'm thinking. The next sponsor, their mascot can be sitting like sampling products in the corner and like a live shot, like just hanging out over there, like having tea, you know, kind of thing. Vape Fruit.
You are the mascot, Dimitri. You are the mascot, man.
You know?
You are the mascot. You are the media mascot.
And we can do 2 or 3, or somebody can be.
From 25 milligrams every 15 minutes until the end of the meeting, so.
Yeah, something like that. All right. Thank you, Alex. Thank you, Eco Pride. Thank you, iLava. Now let's move on to a real honored guest.
Yes.
Liz,
So
thank you for your
excited.
patience.
So excited to have you here today.
A true national presence. Do you want to?
No, go ahead.
Oh, sorry. Yeah, I've known Liz since she co-founded BDS, which is now BDSA, many moons ago. If you just want to reintroduce yourself again and get right on into, everybody's excited to know the national trends and the trends that you've seen in Arizona with the data that you've collected. And then after you do a 10-minute presentation, we'll allow the panelists to ask questions and then keep going forward.
That sounds great. Thank you so much, you guys, for having me. It's been a pleasure. And yes, Dimitri, I think it's been just about since day one, 5 years ago, that we've met and that we've cultivated the relationship and had very close ties into the Arizona market. So excited to share with you all some insights. If you guys don't mind bearing with me for just a moment, I'm going to switch over from video to screen share. I think you'd rather look at my slides than my face for this presentation. So give me just a moment. All right. And just to confirm, Dimitri, we're good. You're looking at
yeah, we got
PowerPoint screen there?
Yep.
Okay, perfect.
Took over my whole computer.
Good. That's what we want for about 5 minutes. So I'm going to move through these slides and these insights very, very quickly because I'm actually really excited to get to the panel part of the presentation and hear from all of the boots on the ground and the experts who are living and breathing and experiencing these trends that we're paying attention to on a national level. So as Dimitri mentioned, BDSA, we are the global cannabinoid market research company, although we have our roots in the USA and specifically in the Western states like Colorado, California, Arizona. So just wanted to take you all through a couple quick insights between our retail sales tracking, industry forecasts, and consumer insights data. We've been tracking the Arizona market both from a retail point of view as well as a consumer point of view for about 3 or 4 years now. Just a real quick, we've shown this timeline in just about every webinar we've given. I'm not going to spend time on it. Just to set the stage, we really started to see these impacts of the COVID experience in mid to late March. Although before that, the cannabis industry as a whole was already starting to experience some challenges in the market, mostly based on challenges in the public markets and some capitalization challenges. So again, those of you on the panel probably can share some insights and perspective into what you've seen on the ground. All of that being said, in spite of all the turmoil, when we ended Q1, the end of March, it was a pretty positive note for the US as a whole, and in particular for the state of Arizona. I mean, I think that, when we're seeing strong double-digit growth across the board, essentially in the markets that we're tracking, but then seeing those very, very strong numbers compared to 2019 for Arizona, compared to the 10% growth in California, 15% growth in Colorado. Maryland's extreme growth, just as a little heads up there, is mostly being driven by increased retail footprint. So about 51 dispensary locations at the end of March in 2019, up to 89 locations in March 2020. So that market's definitely in a hyper growth phase. One call out, a neighbor of both of ours that probably isn't too surprising, Nevada being the one market that we did actually see some negative impacts in the month of March in particular. Not enough to drag down the entire quarter, but clearly Nevada got hit hard by the lack of the tourist market, as well as some of their more stringent and challenging regulatory rules and restrictions in terms of social distancing and shutting down the inside of the dispensaries. So we moved into April, moving away from April and May, and moving away from the peak of the lockdowns, which I just read this the other day, which is it just absolutely fascinating to me. At the peak of the US lockdowns, 94% of the US population was under some sort of stay at home and impacted. So it's a little difficult to see the distinction on this map, and I apologize for that. But what we're looking here is the reopening of the U.S. as we're starting to move into less and less stringent, whether it be phase 1, phase 2. But in spite of all of the talk that we've heard of sort of regional and multi-state strategies early on in the process, and as Will Humble mentioned earlier today or early in the presentation, you know, we really are seeing a very unique process and an individualized process state by state and even county by county and city by city. So pretty confusing patchwork of reopening regulations that we need to deal with on a by state and on a national basis as well. As of the 20th of May, just for a little bit of another benchmark, the state and city populations that were still affected by stay-at-home orders was about 80 million people, or about 25% of the US population. So getting back out there. But what are we getting back out there to? You know, clearly a challenging time, and we're moving out of the pandemic impacts into the long-term economic impacts. And seeing what's going to happen over the summer and into the fall with the recession is going to be a very, very large question in all of our minds. And, you know, we're early indications are showing that retail was a bloodbath in general, but cannabis, of course, outperforming that bloodbath. But just a good reminder that cannabis or no cannabis, retail or general retail or other channels, you know, this response is going to be an emotional response as well as a lift of the regulatory response. So it's not necessarily what we like to call the field of dreams moment, where if we open, people will come. We are still going to need to be dealing with shifting consumer mindsets and behaviors as we're reopening our stores. And new social distancing policies, you know, obviously grappling with those new operational challenges. And again, I can't wait to hear directly from our panel and understand exactly what's happening. But so what does that all mean? So let's take a look at some of these ongoing sales numbers. So just a really quick note about these numbers. This is our early indicator directional data. So it goes all the way through May 16th. And because it's early indicator data, it is not our projected data. So this is a national sample of retailers. Our fully extrapolated and analyzed April data actually was just available today, late today. And just to give you all a preview, for those of you who are clients, probably seeing these numbers hit your inbox very, very shortly, if not first thing tomorrow. But April did end up as yet another positive month for Arizona. And once again, Arizona outperformed many of the other state markets in the US. So kudos to continued strength in overall retail sales numbers for the state of Arizona. But if you look at this ongoing trend, I think you can see a couple really interesting things happening. You can see those early dips and surges in mid-March where consumer behavior was incredibly reactionary. You know, consumers were reacting to the news cycle. They were reacting to stay-at-home orders. They were reacting to changing sort of fear-based stories in the news. And we saw extreme surges, and then we saw some pretty extreme dips in the month of March into the early part of April, where we then started to rebound back again as things like the stimulus checks and a little bit of a settling into normal started to come in around the end of April. Very, very strong 420 did help us move into a more typical sales cycle. So now we're getting back into that cycle where weekday and weekend sales patterns are re-emerging and stabilizing, and looking a little bit more like that pre-COVID-19 typical behavior, where we're seeing that more normal, although potentially altered shopping behavior. So, you know, the kind of the takeaway here is we're moving out of that incredibly reactionary stock up, stock down behavior, but still looking for those longer term impacts to see what's going to happen. Obviously, April was a strong month, but to see what's going to happen in May and into June as potentially some of these economic challenges continue to follow us within the US. And speaking of long-term consumer behavior, just a couple of these major consumer trends that we're paying attention to both in Arizona and nationally. One being, again, that stock up behavior. So as you can see here, what we're looking at is the interplay between store traffic, so number of transactions, as well as transaction value. And you can again see that peak of that stock up behavior, which, by the way, cannabis is a very unique industry, and it also follows many of the same shopping patterns and behaviors of just about any other industry. So we look at traditional CPG markets and traditional CPG industries, and in particular, both the vice categories, so alcohol and tobacco, which are relatively recession resistant, as well as the healthcare categories, which also tend to be recession resistant. So cannabis being in that unique place of falling into both sides of the spectrum, where we see about 70% of consumers in the US report utilizing cannabis for social and recreational purposes, whereas about 50 or 60% self-report utilizing cannabis for health and wellness reasons. And of course, there's that overlapping 30% or so that state and are very aware that they're utilizing cannabis for both purposes. Again, two different ways of insulating the market as compared to some of these other retail industries that are seeing much more significant challenges. The other ongoing consumer shift in behavior that we find very, very interesting, and I do believe that this is going to be something interesting for Arizona as well, although this sample is looking at California retailers, is this shift towards click and collect, delivery, and other online fulfillment methods. So I really do like this chart. What we're looking at specifically, just to kind of orient you all, this is a subset of California retailers who already offered all three major types of fulfillment before the social distancing and stay-at-home rules were enacted. And so what we're able to see, so these are retailers that already had click and collect, delivery, and of course in-store shopping. And by isolating this sample of retailers out, what we're able to look at is the same store impacts on shifting shopping behavior and methods. What we're not looking at, just to be clear, is an overall indication of the growth of delivery or click and collect in California, because the sample is not accounting for new stores adding that fulfillment method, or the increase in market share for delivery only outlets in California. But what we are looking at is again, further indication of a long-term shift in consumer behavior. And again, this is reflected in general retail as well. And one of the things that I've always thought and mentioned and hypothesized is that these large impacting events, such as what we're going through right now with COVID, such as the recession that we went through in 2008, 2009, such as 9/11 back in the early 2000s, what these sort of shifting indicator points in time can do is to actually exacerbate trends that were already starting to occur within consumer behavior. And we're certainly seeing that with this shift towards online shopping and online shopping behavior. What you look at that blue line there that really expanded with the click and collect, the curbside delivery essentially. A lot of that was need-based behavior, and is now starting to react back into your more typical levels. But what we're not seeing come back down is that delivery. So the 2 weeks of March, 6% of dollar share was coming out of delivery in these California stores, moving towards the first 2 weeks of May, where we're seeing up to 16% delivery. So we do expect this trend to not only continue, but as the governments and the state bodies start to become more accustomed and more open to this delivery method of fulfillment, we expect to see this trend continue in the longer term.
Liz, I think that panel, that particular graphic was a big hit, but not for the reasons of the data. Forget
Why
it.
was it a big hit?
I'm just kidding. It just starts to get you a little dizzy. Or so to speak. Maybe something else. Somebody commented about something.
All right, well, this is a pretty good place to end it anyways. And I think that just the point going on forward is, while we've got some pretty big challenges and some hurdles and some hills to climb in the second half of 2020, The BDSA forecasts remained remarkably positive, not just for 2020, but for the 5-year impact or outlook as well. We're forecasting the legal cannabis market to hit 46, almost 47 billion by 2025. The US market is going to account for about 30 billion of that. And Arizona specifically is forecasted to hit about over 1.5 billion by the end of 2025. So very few industries are positioned to share this sort of growth. And big picture really does remain positive for the cannabis industry as a whole. We do expect to see some short-term challenges, of course, in terms of supply chain challenges, social distancing requirements, capital constraints on an ongoing basis, and potentially some demand impacts for tourist-focused markets, which I think Arizona is a bit more insulated than, say, Nevada or even California and Colorado. So while we might be seeing a leaner and meaner and more efficient industry on the other side of 2020 with potentially some fewer players in the market, again, we really do believe the fundamentals are strong, not just for the cannabis industry in the US as a whole, but for Arizona in particular, and really looking forward to seeing what's happening and what we have in store for the back half of 2020.
Well, thank you, Liz, very much. How do we unshare the big screen here? There you go. Now we can see everybody again. Where I lost Liz. Liz is over there. So let's go around with the panelists. And there's a lot of, I'm sure you guys are having deep and profound thoughts about your organizations, the Arizona marketplace, the national marketplace. So maybe not necessarily a comment, a question for Liz, or a comment in general. But if you have a question for Liz, ask Liz a question. If you want to make a comment, make a comment. Mo, maybe we can start with you over there in the ILAVA area. What do you think about what Liz just presented in the marketplace?
I think that, we're looking at data today in a medical space, and it's tremendous the amount of growth that will happen in adult use. Have you any forecasting models from a state where you were medical only and then you transition to adult use with the same number of players? I mean, is that something you have in the toolkit at all, Liz?
Arizona is pretty unique in just how established and frankly sophisticated the medical market is. The best comparisons we have in California and Colorado, I don't think quite hit the nail on the head. But the good news is we've actually done the work to forecast out what Arizona is going to look like as we move into what we, frankly, putting a little bit of a stake in the grounds, do expect will be a recreational market coming by 2022 at the latest here. And so, some of the interesting things, and I'm turning my head here to look at the data that I have right here in front of me. One of the things we pay close attention to as we're moving from a medical only market into a medical and adult use market is the impact on the illicit market. And we do see Arizona following a little bit more of the model that Colorado followed, which means being able to have a very good handle on the illicit and the gray market and that transition out of that market and into fully regulated markets, as opposed to states such as California and quite frankly up in BC and in Ontario, where we're tracking the sales in Canada, where there's a much more established gray market, illicit market, legacy market, kind of however you want to think of that market, that positions some challenges for adult use growth in the first couple of years of establishment. California being the classic example where sales actually went down in their first year of adult use legalization, as opposed to going the direction we all expect it to go, which is safely upwards.
Alec or Frank, and we'll go over here in this order. I have an order on my screen. Before we get into stories from the front lines as to how COVID has impacted you guys' businesses, let's, Alec, do you have any comments, thoughts, or questions for Liz?
I just thought it was interesting with the growth aspect, and we're supposed to be sharing what she said, over a little over $1 million or over $1 billion. I'm sorry, come the other side of 2020, if I'm not mistaken. And I do feel that we are insulated in terms of traffic. However, I mean, I'm not sure what kind of data that comes from for like the snowbirds that come here during, the winter times. And then we also have, what's it called, in March, baseball, spring training, hitting here, and then how that'll be affected once it goes recreational, because I know that'll, we have a ton of people coming from California that, already get to participate in recreational use in California, and how that's going to translate as soon as it comes here with a lot of those, tourists heading this way.
Yeah, I think it'll be really interesting. It's such a great point there, Alec, to see how the growth perhaps of the adult use market might be stymied a little bit by the lack of tourist dollars. But because you're currently a medical market, what we're not seeing is that short-term, immediate impact of the lack of tourist dollars on the Arizona market. And that's really where, the second half of 2020 comes in on that sort of insulation. And I think that's part of what we see when we look at that first slide where we're comparing market by market growth for those states. And except for Nevada, all showing very positive growth, but Arizona really, really seeing an acceleration of growth in 2020, as opposed to some of those challenges that, Colorado, for example, where we estimate about between 7 and 8% of the total sales for cannabis coming from the tourist market. Looking at the Colorado Department of Revenue is estimating that the cannabis sales in Colorado are actually going to decline by about 3% for the next fiscal year, which starts in July of 2020. And their basis for that prediction is purely based on the tourist market. We'll see if that comes into fruition. We actually think that the market might be a little more insulated than they do, but that'll be very, very interesting to watch over the next few months.
And if we can move forward real quickly, I'm looking at this group here. Ilava, Downtown, Jonathan Hartzell, Dispo, Andrew Provencio, Chill Pill, Nature's Medicine, Sublime, Copper State, Sunday Goods. You guys are all so positioned so well for the expansion and growth. I mean, it's just, these words just supposed to be so exciting for you. Punkage, thoughts, comments?
I have a comment.
We'll start with that, Drew.
I'm sorry. My comment would be, for all of us, Mo and Mark and all of us on the call, I think the sales are going to increase 200 to 500% across the board. And we have to be ready to take those sales and service all those sales. And we have a unique opportunity here in front of us. And as an industry, we really have to step up and make sure we meet those demands, because we don't want there to be shortfalls and we don't want people to be getting bad medicine. So I would just tell us all that just keep move forward as hard as we can to be able to supply that great product across the board. So that's what I would say for the group and ADA and MEDA. That's what we all need to be as good business people with licenses in this current market.
Maybe to add to Andrew's comments about being good shepherds of the industry, I think as we go rec, it's so important that this community embark upon the right responsibility messages around the usage of cannabis, much like alcohol, much like thinking through how do we do this in a responsible way. And a bit of the comments that Dr. Humble had about those who are under 21, how do we want to make sure we protect those who may not be yet ready to engage in recreational cannabis? Because if we do a really good job as a community and as a group around that, less legislation or other players will get involved in trying to manage our business for us. So there's a responsibility that comes with rec. It's not all, stack it high and let it fly and get people high. We can't just think like that. We got to be responsible shepherds of this business, and we got to do it in a way that will allow for everybody to contribute in a positive way. So I want to just build on what Andrew said.
Punkage is quite the poet there.
Right?
Jonathan.
He's trying to remember it.
Remember that.
Did you have a question, John?
Yeah. Hey, I think that Liz, BDSA, I guess now, but BDS Analytics has been a real major part of our strategic planning organizationally at DISPO for a number of years. And it was the early work that you all did that and presentations on a weekly basis about on these kind of calls about what was happening in the industry and the predictive analysis of what would be happening that allowed us as an integral part of the supply chain to the industry to prepare and be ready for and prepare our customers for what was going to happen during this crisis, but well before that and also well after it. And the preparation you're doing for our organization is invaluable. I know you place a value on it, and I implore everyone that needs that to chase it and get it and have that data, because it will make us a better industry, knowing the result of the next 6 months before it happens. And we found that you've been more on point with that than any other service thus far. So
thank you.
Thanks
Thank
a lot
you
for
so
the
much,
information today. Really well done, Liz. Thank you.
I appreciate that. Yeah, those words mean more to us than you can imagine. And this is why we do what we do. So, you know, when we always like to say that when the industry wins, we win. So we do everything we can to help that happen.
Mark, thoughts, comments, questions for BDSA?
Yeah, Liz, I appreciate your service as well. We use you, as you well know, in all of our 6 states now, and as you roll out, you know, Maryland and these other states, we've been jumping on board. We appreciate your data. To your point about the illicit market, and this also ties to what Will Humble was saying. And I don't know, I hope Will's still listening. If not, I'd love to follow up with him one-on-one, but there is data out there in the world that talks about the impact of adult use on folks under 21. And there's something called the CDC, Centers for Disease Control, does a study on teens, 8th grade through 12th grade, every year in every other state. And it's a very large database. Anybody can go to the Teen Health Assessment Risk Survey on the CDC website and read the data. And when I got into this business, I did a little soul searching in terms of, you know, how does this impact kids having a medical market and then later an adult use market? And I found by going to that CDC database and just correlating the dates, because I'm a research geek, you know, when the medical came online, when did adult use come online, and how did it impact the numbers the following year with teens using cannabis? And what I found is that they went down. And matter of fact, in Arizona, the first year medical rolled out, the first full year, I think was 14, the numbers dropped 7%. And they continued to erode as the medical market grew and the impact of medical became larger. And I've noticed this trend in other states too. And when those other states went to adult use, it dramatically fell further, the number of teens using cannabis. And there's also a gateway effect. And I know that's been, and I think the gateway thing has nothing to do with cannabis itself. It has everything to do with the black market distribution system, illicit drug, underground market, whatever you want to call it, the illicit community that's selling not just cannabis, but other things sometimes. And that can be the gateway element. So when there is a legitimate place to get cannabis, it really shrinks the illicit market that's selling cannabis to teens, and thus teens have less access to other drugs. We saw cocaine go down, virtually every drug, methamphetamines and so forth in these states that actually rolled out, you know, adult use. So there's a lesson to be learned there. And I'm surprised the data is not talked about more broadly. I have read some research from time to time from those that have dug into this data, basically mimicking this or doing other studies parallel to these studies that come to the same conclusions. But the CDC is a great database that we should be mining, because I don't think Will should be making this a controversial point with the community that, well, this could be a danger. We could see the old argument of more cannabis on the streets is more cannabis in the hands of kids. It's completely invalid, and the data supports that.
Frank and Will, did you guys and Alex, do you guys have any questions or comments or thoughts about Liz and her presentation?
You know, I just want to say that.
Not much. I just went through a similar presentation with Liz a couple weeks ago, and we're very excited to start getting on the platform. So thanks for joining us, Liz. Great work you guys are doing over there.
Frank, then Will.
Actually, yeah, just really a comment. I agree with some of the earlier comments that what's really critical is for the industry to police itself, because the better we do that, the less incentive regulators will have to come in and meddle in our affairs. So I thought that was very excellent counsel.
Well, thank you, Will. Frank, go ahead.
Yeah, I just want to thank Liz for the product that they've produced. It's been very critical in our product development and helping us decide what products we need to bring to market, and what products the patients are looking for. So it's been very instrumental in our growth. So I just want to thank you for providing that platform.
Absolutely. Thank you.
I have a question for Liz. Liz, so we've had a couple questions come in, and I know Nicolette and I've kind of talked about this before, but people have reached out and said, you know, as a part of my Vita membership, is it something that we could also, you know, team up with BDSA and get data? So I don't know if that's something maybe you and I can talk with, but I know a lot of our members would love to be able to participate and have access to all that data that you have.
Yeah, absolutely. You know, Dimitri, I think my very first trip to Arizona about 3 years ago, you and I sat in your office and you and I chatted about some of those pie in the sky dreams about what a fully actualized BDSA or BDS analytics at the time reporting would look like in Arizona. Certainly happy to revisit that. And we firmly believe that a healthy industry needs to be supported by healthy industry associations and healthy specialty retail. And so especially as Mark mentioned earlier, you know, some of those comments about the illicit market and data that might help Will Humble in some of his analysis. We are certainly big advocates of getting that data out there, and especially in the hands of those who will be able to help the industry as a whole. So that's sort of a generalized comment to those of you in the audience as well. You know, I think our information, I believe, is somewhere on the website, Dimitri, and if not, happy to share it and start answering questions.
And thank you for the shout out, Liz, so I can, you know, everybody always says I'm on the cutting edge. If I could just pick the right partners and paper the deals correctly, I would be rich. Everybody laugh at once. Everybody laugh at once. Okay, nobody wanted to join the laughter. You all know what I'm talking about. Anyway, so Liz, closing remarks, and then I'm gonna.
I actually wanted to add one
go ahead,
thing,
Mo.
quick, Dimitri. To add to Mark's point there, Will Humble talked about a few different things, but opioid reduction, especially in states that have legalized for adult use, and then today actually a study just came out where there was a 20% drop in opioid usage, and previously there was one for morbidity that was 35% or more in states that were adult use. So in medical, it's not as impactful. In recreational, it's even more impactful because opioid usage goes down. And I think with BDS, you have an opportunity to kind of look at some of that data and even reach a wider audience and say, look, you know, outside of cannabis, we're seeing an inverse relationship, you know, in opioid usage when cannabis is legalized and available in medical or adult use. So I really think that's something, you know, that we, to add to Mark's point, we need to counter the narrative about teen usage, because really opioids are far more harmful than a few kids trying, you know, a joint every now and then.
Thank you, Mo. And also keep in mind that the studies, I think I've read this in BDS, or there may have been another study that was done actually that said that about half, I think it was 49% of all adult users of adult use cannabis and adult use cannabis states are actually motivated to use it medically. I mean, that's why they walked into a dispensary and bought it. They just didn't want to be in a medical database and in some, you know, they just trust government with that information, but they're fine walking in and just, you know, showing their ID to prove that they're 21 and older and buying it, but their motivation is medical.
All right, now Liz, stick around. We're going to get to what I call stories from the front lines. Each of you can have an opportunity to tell us, you know, imagine you're on NBC News and somebody says, you know, Bunkage, COVID before, COVID after, how has your business changed? Tell us something we don't know. Was there an employee who was really sick? Did you have to redo your hallways? You know, tell us, how has COVID changed Copper State, the Copper State culture, the Copper State business? And if nothing's changed, which I don't think is the case, how has it changed you personally? And we'll do a little round robin here. Does that sound good?
Sounds like a plan. I think for us, it's been, I divide the way we've dealt with this in two phases. One was in mid-March to mid-April, which was the shock and awe of what is COVID-19? Is this going to affect my employees? Is this going to affect each other, affect my family in a way that is scary, unknown, uncertain? And there was a lot of fear. I think there was a lot of concern. I think it provoked, for anybody who had any form of there was a range of emotions that I know my employees felt. Simple things, patient advocates, bud tenders who would normally be very comfortable in most environments were suddenly highly uncomfortable. People at the farm that were hand trimming suddenly felt very uncomfortable with their colleagues because there was less than 6 feet. Anybody who coughed was now being stigmatized as potentially having COVID-19. There was just all that, there's a tremendous amount of concern and fear in that phase one. And we went through an extremely radical level of segregation, isolation. We did what we felt was the right thing to do, both for our employees, the patients, and our family members. And sometimes we erred on the side of being too strict. Sometimes we weren't strict enough. But it involved a lot of daily crisis phone calls. I was blessed with a great leadership team who stepped up to the occasion. Knock on wood, we have not had one single positive COVID-19 case so far. So knock on wood. We felt we may have had a couple of close calls. I do stand corrected. Actually, one employee at the farm was diagnosed with COVID-19 positive, but this particular individual was already isolated, self-quarantined at home, and that particular individual got COVID-19 post being sent home. But so far, so phase two, I'd describe it as accepting the new normal. And accepting the new normal is the phrase that I like to use, which is we all need to work. We all need to make sure we can provide a means to create the medicine, to curate the medicine, and to dispense it to our patients. And at some point, accepting for each person has to have responsibility for how they approach their job. And if the requirements of the job make them feel uncomfortable because of what it may bring to their loved ones at home, they need to let us know, and we will try to accommodate that. But at the end of the day, this is not a non-for-profit. If we can't create the virtuous cycle of farming and putting great medicine into the hands of our dispensaries and our customers, who will then put in the hands of patients, the virtuous cycle ends, and you'll have what happened in the restaurant scene, which is a lot of restaurants are not reopening. They can't go through a complete closure and not reopen and open. So many are staying shut down. Many jobs are being lost, and I think some are going to be lost forever. And that's what scares me, is the economic carnage that's happened from COVID-19. That's what I had actually a lot of sleepless nights, to be frank, just making sure that if we got into a COVID-19 and I had to quarantine a big swath of our employee base, how could we do that safely and save as much crops as we could and still keep that virtuous cycle going? So my lessons learned was communicate, and over-communicate with the team. And we did a lot of sessions where we got feedback. Some were uncomfortable, to be honest, because there was a lot of frank opinions and emotions being shared. These weren't easy. My second lesson is really evolve on the fly. So a lot of things we did in the dispensaries was just, we tried a particular model in, let's say, Tempe, it didn't work. They would try again, and they tried again. And they finally got to something that worked both for the patients and patient advocates, but really empower the dispensaries to do what they felt was appropriate based on the size of their square footage and the constraints they may have. And I think my last lesson is really try to listen. So everybody has their own risk tolerance around this. I am wired a certain way. That doesn't mean that the way I think about risk is the way everybody thinks about it. So I tried really hard to listen, and I could feel much more anxiety was out there than sometimes was being shared. And once you kind of open people up, you realize there's a tremendous amount of concern even today around COVID-19. So I think the lasting legacy of this will be for our company. I question whether we need the size of our home office here in Phoenix. I am actually sitting there now. I'm one of the few people who occasionally come to this home office. Everybody else, the finance team, the marketing team, our sales team have stayed kind of working from home. So why do we need to spend all this rent on a home office is a question I have. It's sort of working. I miss seeing a lot of my comrades, but for now, this is kind of working. I think the second legacy is on the dispensary side is everything that Liz shared around curbside pickup and delivery from home will accelerate. All those trends are going to accelerate. So we're looking hard and earnestly at providing those services for Soulflower. And I think lastly at the farm, there were maybe practices we did, which if COVID-19 comes and goes, I think we want to be prepared for the next contagion that may come out of wherever it comes out of, because we clearly weren't set up in a way. We had people really closely sequestered together and we're still not great there. We got to do a lot more work there. So I want to be set up for the next time this happens.
Thank you. And folks, this is set up to be like a who's who in the cannabis industry, to give you a snippet of who they are, and their contact information will be on the META website. You can reach to them directly, learn more about compensated punkage. But real quickly, I'm going to move to Alex here, but we've had a few questions and they're very similar questions and they're going to be for Will, but want to give you like 5 minutes to warm up on this one about the liability and the businesses and regarding that whole issue. So just take 5 minutes because I know it's a complicated subject, but there's a lot of chatter about that. Let's move on to Alec. Tell us about Sunday Goods, stories from the front lines. How did COVID treat you? Mute. You're on mute.
Always make that mistake. So honestly, I mean, we had the, I believe, unique challenge of opening up during a pandemic. And a lot of the panelists, as well as even some of the audience members, I know, as it is, it's pretty difficult. You have a difficult set of challenges opening up a dispensary in Arizona in the first place. And then taking on a pandemic and the unique set of challenges that poses, I think it definitely required a lot of creativity, as Mr. Penkage said, which he nailed it on the head. I think adapting on the fly is definitely something that dispensaries and something that we've had to, trial and error, especially, I mean, even aside from the dispensary operations, training my staff for dispensary opening, in order to keep people safe, we had to take a different approach. You couldn't have massive groups of 10 people, in one spot. You ran the risk of, exposing your employees and exposing others in the organization, just to train them for an upcoming dispensary. So that was some things we definitely had to adapt to. We have a great organization, great leadership. So we definitely were able to, get creative with how we open our dispensary, training our team members, getting everyone up to speed. And then the next challenge was honestly just, day one of store opening. How are we going to receive our patients? What's the perception going to be from patients? Are we going to be wearing masks? What's the sanitation standards like? And that's definitely a day-to-day challenge that we face. And I think our team does a really good job of. I've seen really good job from other dispensaries and, definitely our partners coming in as well for like deliveries. They're masked up, they're gloved up. We're all following the same safety sanitation standards. So, I mean, overall, it was very challenging, but in the end, I mean, I think, we're like everyone else, we've executed flawlessly in most ways and, definitely here to serve the patients. And, the essence of our brand is making people feel good. And I think that's exactly what we've done. Opening our new 1616 dispensary off of 16th Street in Glendale. And yeah, I mean, that's my take on opening during a pandemic, but.
You make me feel good with the quality of your video and audio. So, Andrew, Provencio, Chill Pill, Uncle Herbs, and I assume you guys stopped taking returns on jewelry during the pandemic.
We always take returns for any of our products somebody doesn't want. I basically was a first responder for 30 years, and we had Hep C, and we had AIDS, and we had all those things. And so what I've really noticed about this, and what I've noticed in our operation, is that different customers and different employees have different levels of comfort, different comfort levels. Some people are very, very afraid of this, and some people have different morbidities that cause them to be more susceptible to catching the virus or think they have those. And I think we have to be really, really cognizant of the different levels of safety and concern that each individual has, and then provide them an environment that takes those things into consideration. So some people may always want to go curbside at this point, or never come into your store again because they just don't feel good. and we need to be able to serve those people. And I think we need to be able to serve the people that are younger and would come in and don't really have a care at all. But at the same time, we have to, our patients and our employees are equally concerned with this, and we need to take care of that thought process. So that's what I believe. When I was responding as a first responder, you see people that are just scared that they're going to die for almost anything, and then you see the complete opposite of that. So I think what I would say is, let's just not have one way to do it for everybody, but let's have some choices out there so people can feel very confident that the services that we're giving and so forth are out there. So that's what I would say.
Well, thank you very much. Now let's go back over to Will. Will, are you ready for my really deep legal question? A lot of businesses are concerned about liability. There's talk about state and federal liability waivers and this and that. What you got any thoughts or opinions on that subject?
Yeah, I do actually. Thanks for asking. You know, what I'm telling all of my clients is really not to worry. That it would be very difficult for a customer to really establish causation. That is, somebody comes down with a COVID-19 diagnosis, proving that they caught it in your establishment when they're going to the grocery store, to Walmart, to Costco, when they're probably interacting with other people, would be nearly impossible. And it wouldn't make much sense for plaintiffs' attorneys to bring those cases unless they were really talking about significant damages in the form of a death. And in that case, you have a wrongful death case. And even then, you've got these crazy issues of causation. That is, did you die with COVID versus did you die of COVID? So I think most plaintiffs' attorneys are going to steer clear of those cases. I can say that litigation is going to ensue over this. You know, lawyers are a clever bunch, and they're going to find ways to profit off this, and that's okay. Everybody's entitled to make a living. I will say this: we are noticing from our clients just an incredible spike in cyber crimes, in ransomware, data breaches, and things like that. And the catalyst for that are so many people working from home, because it's so much easier to attack and get into a system if you have an employee using a remote access portal. So I think that's something you need to be concerned with, and make sure that your cybersecurity software is buttoned up very tight. Also make sure you have a good cyber insurance policy, so that in the event you do have some kind of massive data breach where, for example, customer financial data gets out, you've got insurance coverage to protect against that.
No, that's great. That's great help, Will. Thank you very much. Other than the remarks that you made, anything else related to Tiffany Bosco or personally that COVID has touched you that you want to cover? We're running short on time, so everybody can keep it to 2 or 3 minutes, but you're up first, Will. Okay, let's move on to Mark.
Hello. COVID definitely impacted our business in a major way. We're a high volume dispensary over on the corner of 25th Avenue and McDowell, particularly. We had another location that was a little lower volume in Fountain Hills, and the contrast in how COVID affected those two businesses were very different. We were in a high volume dispensary in contrast in Fountain Hills, and handled it pretty easily. In Phoenix, though, we're limited to 2,000 square feet, and we're doing several hundred customers a day. So it's very difficult to manage that. We're, high volume, low margin, and we had to, on the fly, make a lot of changes. I mean, we immediately took down our lobby. We just brought out all the furniture and set up some additional checkout stations to help facilitate pre-order. And the pre-order system quickly became overwhelmed as well. And then we had patient service providers who had various challenges at home with vulnerable, folks in their homes, either taking care of elderly folks or children that were perhaps vulnerable and had to, work from home or call off until recently. So we were short-staffed and had a run-on business at a time when we were really constrained with social distancing. So it was very challenging, to be honest with you. I think we handled it really well. We had to be very flexible. We did shut down a number of the stations, but again, opened up the lobby. We had to turn our parking lot into a waiting area. Thank goodness the weather was nice at that time, but we put up a big circus tent in our front parking lot just to keep people out of the sun, put in a couple of industrial swamp cooler blowers, to keep them cool and comfortable, brought in food trucks, you gave away complimentary water and food to keep them comfortable. And we tried to do everything we could to accommodate the issue. But while they were waiting outside, 6-foot distancing, we had to have extra personnel to make sure that people were truly, safely distancing from one another, because instinctively they would want to congregate. So we really had to go on the fly and make a lot of moves. Since then we've, set up sneeze guards, at all of our stations. We went out and bought a lot of PPE, face masks, rubber gloves, and so forth. We've given away, I think, more than 10,000 of these hand sanitizers that we had made at our lab free of charge. We took a CDC recipe and beefed it up a little bit with some menthol, or I don't know, mint, I think it was actually peppermint, to make them smell better, put a little something that made them a little more moisturizing. So it's not just pure alcohol. But we've really tried to spring into action and accommodate business in a COVID climate. It's been very difficult. Cleaning and sanitizing constantly. 6:30 in the morning to 11 at night. We have people that do nothing other than just clean. You'll see them in their washing windows, washing counters after every patient. And we really took this thing seriously, as we needed to. And health monitoring has been interesting. We are taking temperatures of virtually every patient service provider as they come in. They have to show their agent card to come to work and say, I've got my card with me. And everybody who works in our cultivations down in Amato for Organawana and behind our Phoenix dispensary, where we create, Phoenix Cannabis Company products, their temperatures taken every day. And, we actually have caught a couple folks that had fevers. They weren't COVID related, but you never know. And had to send them home. So we've been very careful about that. We actually wanted to go to technology. We checked this out early on, the infrared cameras. We tested 3 different brands, including the FLIR, which is pretty popular. And I understand that company has gotten contracts with TSA. They're going to be part of the airport check-in process now. When you pass through, there's going to be an infrared camera that will take your temperature. Security person will look at a monitor and they'll know that you're in the acceptable range or not. And they can pull you out early. We had hoped that might be used in all of our check-in facilities in our man traps, or security vestibules with the double doors, where the patients come in and show their ID. However, coming in from outside, the skin temperature absorbs some of the solar energy, and we found that everybody was running a fever of 3, 4, 5 degrees. So you have to be indoors for a period of a few minutes for that solar energy to leave the skin surface. So those devices didn't work, although I had hoped they might. We could put them in across the country. I think they will be useful in airports, though, after doing some testing. Other challenges were just, dealing with the replacement of staff that didn't feel comfortable in coming to work with COVID, or had vulnerable folks at home. We were able to very quickly on the fly hire a lot of people, train them. A lot of them are, bartenders, waitresses that were out of work, that were looking for, a paycheck. And they were terrific people. The unfortunate part is now that the restaurants and bars are starting to open up again, we're finding some of those folks are going back to their old jobs. I guess that says something about bud tending. It's not as fun as everybody thinks it is. You're dealing with anxious patients and a population that's pretty demanding. And I think people come to this industry thinking it's all fun and games. And it is really about caring for patients who sometimes are not feeling the best and are sometimes anxious. And that takes a special skill set to make it work. So my hat's off in closing to all of the patient service providers that we've had working in Nature's Medicines, who have come to work every day in self-sacrifice to take care of the patients first and put their needs ahead of their own. These essential workers are heroes in my mind as well.
Well, all of you on this call run incredible shops. Another cool Zoom thing we came up with, which I forgot about 30 minutes ago, is you can rename yourself to your email contact info on your screen. So if you click on the right-hand corner of your own personal window, you can rename it from Alec to your email. So from now on our Zoom calls, after 30 minutes, we're going to switch it over to an email address so people know how to get in touch with you directly, which is kind of cool. Rather than Mo, it will have your email address. Nice little touch. We're trying to get things going nice here, but it's really easy if you guys want to learn that. There you go. Alex got it already. Frank, close up. You got 2 minutes.
Hey, thank you very much. Yeah, I just wanted to make a surprise announcement here to the panel and all of the people out there, attendees.
Like surprises.
we're coming out with a new product. It's called Sprinkle, and it is a tasteless, odorless powder that you can put on any food and put in any drink. It's well positioned for the rec market. 10 milligrams comes in this pouch with some instructions on the back. It is a proprietary patent pending nano-emulsified process that is used that will make it hit faster than a normal edible. And I actually have John here who sampled the product. John, could you talk a little bit about your experience?
I ate it this morning at about 8 a.m. In 22 minutes, I caught a little buzz. It's 10 milligrams. So, you know, for me, that is like mid-weight for me. I'm a 20 guy, but I certainly caught a buzz. And the edible feeling I sometimes get of lethargy after taking it, I did not feel. And also, the brand is dope and the packaging is great. So, talk to us about that.
Frank, thank you very much. You know,
Thanks,
I just real quick, I just want to be very clear. This is a effort together with Vantage Biosciences, who we partnered with to bring this product, very unique product to market. This is a product that there's nothing else like it in the Arizona market. So this will be coming to the market in June. So we're very excited about it.
Okay, and you gave me another idea for another virtual event, which is I'm going to invite all you back. And I don't know if you're going to say yes, but we're going to do 9 to 12 members of the Arizona industry.
Yes.
No limits. No limits. Speak your mind. Whatever you want to talk about, we're just going to go. Bring a glass of wine and or your whatever else you want, and we're just going to have a conversation about life. That'll be in July. Mo, you want to tell us about your COVID experience and sum things up? We got about 3 minutes left here, so.
Yeah, thank you. So I think the best way I can sum this up is, yes, today we have PPE, we have, you know, air purifiers, thermometers, all of that. But the first few days of this happening, like, there was a little bit of fear. I mean, I was feeling it just as much as everybody else. And, you know, my business partner, Chip, who's in Seattle, called me, I think it was early March, and said, hey, I was able to get to the Starbucks, which is empty, by the way, in 12 minutes instead of 35 on the freeway. Everything's like dead. You know, let's get ready for this. I was like, I don't know exactly what to do here. But, you know, I was like, okay, let's, you know, I started looking, couldn't find masks or anything like that. Like, let's see what happens. Maybe it's not that bad. And I think March 16th was the day where we realized it was bad. And I was driving right, you know, to our meeting. And I was like, I'm going to call Vicky from Earth's Healing and just see where she's at with everything. And I think she may be an attendee on this call. And they have 2 locations in Tucson, so do we. And I realized, hey, it's time to shut down our dispensing area and all of that. It's because, you know, she gave me good information and what the practices were they were doing. And I think that's kind of what happened is this brought us all together a little bit here because I don't have all the answers. None of us do. And when that moment happens and you're a little bit vulnerable, you're like, yeah, let's reach out. Let's figure out what's really going on. Because yes, we may be, you know, we're in the same market, but when something like this happens, I think we all kind of have to come together. And I think that's what this is about. So in, you know, my thoughts on this, and then Mark also had, you know, his formulator share their hand sanitizer recipe with us. And we were able to make some of our own and didn't give away as much, but we gave some away. So again, it's one of those things where COVID has brought the industry to a place where we're a lot more united. And yeah, we're going to have to do curbside and delivery and all those things. But I think there's also the human perspective here. And that is the fact that it's changing our business, but it's also changing the way we interact with each other and how we view each other. So I think that's a big part of this.
Well, Mo, we appreciate your organization sponsoring this, and Copper State, Sunday Goods. I like to say vape fruit, Mark. I'm just going to go with vape fruit because I think vape fruit's going to be like grape nuts. You know, that's just the whole thing there. Will, thank you. You guys run a great law firm at Tiffany Bosco. Everybody knows how to get a hold of you. Sublime, Stony Yoni. We didn't have a chance to talk about that, but Frank, you're definitely invited to the No Holds Barred conversation. Andrew Provencio, Uncle Herbs, Payson.
You know, I won't let you down, Dimitri.
Oh, there's Pam Donner.
Did we tell them about our next one?
Wait, Pam Donner back there. There's a preview. Look, we have a preview. She's going to be one of our Arizona Women of Cannabis for June, on June 17th. Danielle's going to be hosting. We're going to have all women. It's going to be amazing, featuring women entrepreneurs and up and comers. I think we might have somebody from different organizations. If we're going to invite Jane Fix from Copper State.
Perfect.
Danielle,
I'll be reaching out this week.
so Mo, again, I love it. Thank you. Thank you, Eco Pride, for sponsoring. I hope you all enjoyed our 3D advertisement. I'm going to let you close everything, Liz, in 1 second here. John Hartzell, Dispo, always a pleasure. I want you sitting here next time with the three of us, and we can co-host, because I know how you have so many things to say, which is great. So you guys, thank you. This has been an absolute pleasure. This whole thing doesn't happen without Danielle and Destiny putting it together. So we're just chilling. I'm a mouthpiece. I happen to know a lot about a few little things. And, folks, this is the Arizona industry out there. Liz, you want to say goodbye to everybody and let us know what you thought about our little show here today?
Yeah, absolutely. Thank you so much for having me. This was a whole lot of fun. And I think maybe next time I will bring a glass of wine or maybe some sprinkle or some other cannabis beverage to enjoy. But no, thanks you guys so much for putting this on. The community needs it, the industry needs it, and you fulfill such a great role. And we really, I know, hopefully speak for everyone how much we appreciate what you guys do for us.
So, thank you all for tuning in.
Thanks, guys.
And we'll see you June 17th. Thank you guys very much.
Bye-bye.
Thank you.
Have a good night.
This will be available on YouTube and video, website, etc.